Hello my beautiful friends, welcome back to my channel. I hope you're all having a really great day today. I wanted to sit down and share with you guys my most recent oncology appointment. I am 4 months postpartum and my appointment was like 3 weeks ago, so this is not something that just happened, but I have been a little MIA because things have been a little crazy. So I wanted to share with you how all of that went, but also someone had reached out to me a while ago, and I apologize it's taking me so long to do this, and they wanted me to go over the differences between Zoladex Anastrozole and Tamoxifen as far as treatments go. So I will touch on that as well. And also something that I'm dealing with currently that is really kind of throwing me a little bit. So if you are new here, welcome. If you are here because you were recently diagnosed, I am sorry. It sucks. One of the reasons I started my channel was to be a resource to people who are going through this. I did it a couple years after I was diagnosed, which I wish I would have done it sooner, but didn't think of it. But a little background of myself and my diagnosis. I was diagnosed with stage 2B invasive ductal carcinoma when I was 29 years old. I am also HER2 positive, so I'm hormone receptor positive. We have no breast cancer history in my family. There is a lot of cancer in all different types, but no one has had breast cancer that we know of. So it turns out I did have genetic screening done because of that, and it turns out that I have two of the less common genetic mutations, which are ATM and CHEK2. Both of them have a high risk for breast cancer, but also pancreatic, melanoma, and colon cancer as well. I think that's it. So I am in a high-risk clinic for colon cancer because my paternal grandfather died of colon cancer. So every 2 years I get an endoscopy and colonoscopy done. I did have the option when starting treatment to start with chemo or do a double mastectomy. I did have two tumors in my right breast, one directly under my nipple and one like here. And it spread to my lymph nodes, which is what the 2B stands for. I opted to do chemo first to hopefully try to shrink the tumors so that they could save some of my skin, because I was not a large chested woman before. I barely filled a B cup raw. And I actually responded really well to chemo and I will say that this was like a very satisfying thing for me because I was horribly ill. I did not tolerate it well. But I could physically feel the tumors shrinking. So it like made me feel good that because I was so sick, it was at least doing what it was supposed to, if that makes sense. So I had 18 weeks of treatment. My treatment was every 3 weeks for 6 weeks, or I had, 6 treatments. They were every 3 weeks over 18 weeks. I had 2 targeted therapies and 2 traditional therapies. The 2 targeted therapies, one of them, Herceptin, I was on for a full year, but that one did not cause me to be sick or lose my hair or any of that stuff. It was all the other ones. And then I did get a Neulasta injection 2 days after my treatments. After chemo was done, I opted for a double mastectomy. I only needed the one side done, but I wanted to just get rid of both so that I didn't have the chance of recurring to the other side. They immediately put tissue expanders in because I knew I wanted implants. After my mastectomy and then the tissue expanders, they slowly started to stretch my skin. Then we had to stop and actually take some out of my right side, or no, my left side, because it was too tall for the radiation, whatever it was. So after 30 radiation treatments, I wound up having 5 additional reconstructive surgeries. My wounds broke down. I had MRSA. I had a bunch of infections. Like, it was a shitstorm to say the least. And what else? Oh, endocrine therapy. So while I was still going through like my first surgery and radiation, I started Zoladex and Anastrozole. Now, Zoladex, I'll talk about all the, like, my side effects as I go along instead of separating it into a separate section. Zoladex is a and also please understand, I am not giving medical advice. I'm just simply sharing with you my story and my reaction and whatever else. But Zoladex is a subcutaneous implant injection. I will put a picture somewhere up on the screen of what the needle and implant looks like. It is not enjoyable. Most nurses will like fight with each other over who is not giving this injection because it's not pleasant. It does hurt. I bled, I bruised. It was very sore. It was just not a pleasant experience. But a combination of that and then taking anastrozole as well, which was just a very, very small pill I took every day, medically put me into menopause. So I had no estrogen or progesterone, or if I did, it was very, very small. Again, I'm not I don't know. I'm just saying whatever. So, again, I was probably 30 years old at this point. My body knew I was not supposed to be in menopause. And let me tell you, my body fought every moment of this treatment. I was miserable. I mean, miserable, to the point where I was supposed to be on it for 5 years initially. And then they kicked it out to 10. And I said, I literally don't know that I can live like this for 10 years, let alone 5, or 5 years, let alone 10. And they said that your quality of life is obviously very important. There's other options, blah, blah, blah. But I knew that that was the right thing to do, so I stayed on it. Now, as far as my symptoms and side effects went, and again, everyone responds very differently to drugs or treatments. And if your doctor is recommending that you do this, do not think that my experience is going to be the same as yours. It could be wildly different. So again, I'm just sharing mine. You can take every single menopause symptom, and I had it to an extreme level. It was horrendous. The absolute worst was the hot flashes. They were so bad that I would have to, and we live in New York, so it's cold half the year. If I was at work, in a building, at a restaurant, whatever the case was, and I would get a hot flash, it was so overwhelming. I would have to get up and physically take myself outside to cool down because I would feel like I was going to pass out. So they wound up putting me on gabapentin for that, which gabapentin brings its whole other sort of issues with it, if you will. So I was not a fan of that, and I didn't enjoy taking it. I'm not a good pill taker. Let's start off there. I don't like taking medicine. Even regular supplements, I'm not good at remembering to take it. So it's just, I didn't like gabapentin at all. But it did help. It didn't completely take them away, but it definitely helped. The problem with me was I had to keep increasing the dosage, which is what I didn't like. So, but there's a huge range of dosage that you can take. So that was the worst. Hot flashes for me meant night sweats, and they were so extreme. I'm not exaggerating when I say I would have to remove my clothing 2 to 3 times every night because I was literally soaked through them. I would then have to put a towel down where I laid because my sheets were soaked, and then I would have multiple extra blankets in my bedroom because my blanket would be soaked, so I would have to use a different blanket after that. And I can tell you the amount of laundry that I did was astounding. Which also meant I didn't sleep because I was constantly getting up. It was just like a constant whatever. Weight gain was a definite thing. I've always been a relatively thin person. I had 20 pounds on me that would just not leave. And is that the end of the world? No, but for me, it was a big deal. It was very hard to lose it. It was just like something that had happened. And it was just uncomfortable. It was just really uncomfortable. I had absolutely zero sex drive. Just gone. Just not in existence. I was also drier than a Sahara desert, so that was super enjoyable as well. It just wasn't great. My body just did not do great with that. So what wound up happening was, and there may have been other things, but those are like the really, really big ones that like really stick out. After that, well, during that time frame, I had switched jobs and my insurance lapsed for 1 month, and I wound up missing 2 injections because they just never called me to ask questions, and I wound up getting pregnant. That's how much my body was like, get rid of this. And I was pregnant within like 5 weeks of being off the treatment. So we now have a very healthy, beautiful, perfect 3-year-old son, Xavier. And I obviously did not take any treatment during that time frame. But also my oncologist wanted me, I still continued to go for blood work just so they could monitor stuff. But after that, he said, I want to put you on Tamoxifen because I should tolerate it a little bit better, and it's not as crazy, and it's just a pill I'd have to take every day. So after my 4th trimester, I went on Tamoxifen, and honestly, it was fine. Like, I didn't have hot flashes. I got my period every month, and it was like so regular. I could tell you I knew like there was between 2 days that it would come, and I would wake up in the morning with cramps, and I knew that was the day. I would wake up, I would go to the bathroom, I would get my period, and then that was it. It was very, very predictable. But I don't really, like, I was never nauseous on it because I always took it at night, so I would kind of like avoid all of that, or hope to, because my stomach's very sensitive to medicines, vitamins. I can't even drink tea on an empty stomach because I'll get sick. But it was tolerable and fine. Like, I didn't feel 100%, but it was a dream compared to the other treatment. So in April of 2021, I wound up having a pregnancy scare, and I called my OB and my oncologist, and my oncologist is like, because tamoxifen is toxic to a fetus. So the whole time I was on it, Eric and I were very strongly preventing pregnancy. And then, so I had this scare, and my oncologist, I took multiple tests, but like the symptoms I was having, they're like, we're just not 100%, so just stop taking it. So I did. And then I took it upon myself, and again, don't do as I do, do as you are told. I decided, you know what, I'm going to just stay off tamoxifen for the rest of the year and see how my body feels, because my hormones have been manipulated since I was, I think, 17 when I started birth control. So I just wanted to see how I felt and how my body did without it. Again, this was not for my doctor. I did not have this conversation with him. It's just something that I chose to do. And it's probably a good thing I did, because I wound up getting pregnant in September, and again, not trying. So during that time frame though, when I came off of the tamoxifen, I had called my OB and I told him, and this is one of the things I asked the nurse practitioner when I went to my appointment. I asked her, or I told my OB, the week before my period, I am getting wild mood swings. Like, you could look at me funny and I like just fly off the handle. And he said, it's not unusual for hormonal changes to affect that. And I said, is there something that I can take like that week to help with that? And then, whatever. And he said, there's not anything you could take for a week. We'd have to put you on something like all the time to see if that'll help regulate it. And you wouldn't believe the amount of people we have to do that for. So I said, fine. And he put me on Zoladex. It was like 10 milligrams or whatever it was. It was super low. And he's like, try this, see how it works. And it helped. I mean, it really helped. And I was very hesitant to like share that information. I am an anxious person, like 100%. There's always a million things that I'm thinking about, and I'm just that way. But I never thought that would be something that I would have to do. But I will say that it definitely helped with my mood swings. And then the day that I found out that I was pregnant, I obviously stopped taking it, and I was fine all throughout pregnancy. Afterwards, though, it started all right back up again. And so I asked my doctor to start the script back again, and he did. And I had taken it for like a month. And again, I'm not good with taking pills, so I didn't take it every day, which is something you have to take every day. It's not something you can just pick and choose what to do. But again, don't do as I do. So I was not good at it. And so when I went to see my oncologist or the nurse practitioner, for my appointment, I had explained to her, and she had told me, like, he just said, you're going back on tamoxifen, so that's what we're doing. And I'm like, all right, whatever. And I wanted to have a much bigger conversation, but it wasn't with my doctor anyways, so I figure I'll just do it later. And so we started the tamoxifen back up, and I asked her if, I explained the whole hormonal thing and the Celexa and whatever, and I said, if I go back on tamoxifen, do you think that'll help? Or whatever. And she said, how am I supposed to know? And I'm like, I don't know. You're old enough to be doing this for probably 50 years. Like, you would think that maybe someone at some point had a similar situation. Like, I'm not asking for a definite answer. I'm just like, in your experience, have you anything, like, whatever. And she was just not my favorite person. She's very nice, but like, the whole appointment was just a disaster. So I leave, everything's fine. And then she tells me, that was the other thing, my sodium was low, which she didn't really seem bothered by. And she said something about my kidney function, but she didn't explain it. But I was so irritated that I didn't ask. So I looked at my results, and I think I'm just dehydrated because I 100% don't drink enough water, which I should, but I don't. Another thing I'm not great at. So she puts me on tamoxifen again. She calls me later that night, actually. I'll stop there. So I told her at the appointment, I'm just not going to take this Celexa. I'm going to wait to see how I feel with the tamoxifen, and if I feel better, then I just won't take it. But if I don't, we'll reevaluate in a couple months and go from there. And she said that the tamoxifen will take only a few days to kick in, like to start feeling side effects and stuff. So I said, okay, I should know relatively soon. So she calls me later that night and says, as I'm ordering your tamoxifen script, it brings up drug interactions. And tamoxifen has a ton of them. And it's not just like other medicines, it's herbal supplements, herbs, like all sorts of whatever. So I'm like, great. So she says Celexa and that have a drug interaction, and it can cause a heart arrhythmia. So she needs me to go for an EKG. And I'm like, okay, well, that's easy enough. I just won't take it then. Like, well, that's it. If I have to be on this, I won't take that, and I'll just figure that out later. And she said, well, I'm going to order the EKG anyways. We'll have you come. So I'm going back in 6 months. And I'm going to have an EKG before phlebotomy, and then, sorry, baby girl. And then I'll see my doctor. Well, a nurse, but I'm going to try to redo that to actually see my oncologist this time. So I start taking tamoxifen. And let me tell you, this was not good. A couple things are happening. One, I have hot flashes. Not a huge deal, not worried about it. I can manage those. Two, my hair is falling out so bad. I'm probably going to be bald by the end of the year. And if I don't wind up shaving it first. I'm not kidding when I say, if I run my hands, holy shit, nothing came out. There we go. If I run my hands through my hair, so I don't know if you're going to be able to see this. You're not. I have 1, 2, 3, 4, 5, 6, 7 pieces of hair that just came out of my head. And I'm just running my hands through my hair, not pulling it out. It is literally falling out. I am afraid to brush my hair. I am afraid to wash my hair. I am afraid to do anything with my hair because it's falling out like crazy. The back of my head, like you can see my scalp. If I pull, I mean, it's just My part, it's just like, it's leaving. I also am postpartum. Stress, I'm sure, helps. I had COVID and now this tamoxifen. So there's a few things playing into that. I did make an appointment to see my dermatologist for this, to see if she can give me something or whatever. But if you see me with a shaved head pretty soon, don't be surprised. My hands and my feet hurt. So bone pain is a pretty popular symptom or side effect. I legit feel like I have arthritis. Like, I feel arthritic. And I don't know what that feels like. I've never been diagnosed with it before. I've never had bone pain before. But I tell you, the bones here, especially in my hand and here, they're here especially, well, these two spots, I feel like they're on fire. They just hurt. It's hard for me to open certain things, like move my hands a certain way, and then my feet, like my toes hurt. So there's that. The worst of all are the mood swings. That week before my period, where my hormones are all over the place, that is me all the time now. Just 100% all the time now. I am an intolerable person. I don't even know how to explain this, and it's going to make me upset. I can't even stand to be around myself sometimes. Like, it's so bad. So bad. I have a 3-year-old who is learning how to be a human, and he tests our patience and he tries to get away with stuff, and I literally have no patience for it. And I yell and I don't want to, and it is a problem. My family doesn't deserve this. My fiance doesn't deserve this. Like, and it's not anything that anyone is doing. It's me, but I can't control it. Like, that's the scary part, is I can't. It's like, and it's only when I'm home, because this is like my safe space and like my place. If I'm out or whatever, it's different. But I don't know what it is, but I finally called I left a message for the breast clinic yesterday, and I told them, I said, I cannot function like this anymore. I said, I don't know what to do. I don't know what the statistics are for me taking tamoxifen. If it gives me an 11% chance of not having a recurrence, like, I can't do this. If it's 87%, then I need to stay on it, but I also need to take something else to offset all the other nonsense that I'm going through, because I can't function like this. So as I'm explaining this to her, and I'm explaining to her how bad my mood swings are, she said, you absolutely need to stop taking this. She said, stop taking it right now. She goes, you cannot do that. She goes, you cannot live that way. She goes, you are not in the right state of mind. And then she asked about the Celexa and said, maybe because I stopped taking that too. But I told her it was only for a month and I wasn't even taking it regularly. And so she doesn't think that that's part of it. And I told her, I said, I don't know what to do. Like, I need some help. So she said she's going to send over a message to my oncologist and see what he says. And that was yesterday. I have not received a phone call today. I don't know if I will or not, but I don't know why I reacted like this to it this time. I don't know why. Like, I was totally fine on it before. So I don't know if it's something, I don't know. But I tell you what, I was pretty relieved when she told me to stop taking it, and I don't even know if they can do something else. I don't know what's going to happen, but I know that I can't function like this. I just can't. So this little girl is ready to eat, so we are going to end this update here. I hope that if you guys are experiencing things somewhat like this, that you do talk to your doctor, because they can change things, hopefully make them better. Who knows? Just have that conversation though. I will see you guys in the next one. Bye. Say bye, big girl. Say bye.